What exactly is a platypus? This animal lays eggs like a reptile, but is warm-blooded like a mammal. And what about a light smoker? The term light smoking can mean no smoking in the last month, smoking 1 to 39 cigarettes a week, or smoking 10 to 20 cigarettes a day. A big part of science and modeling is defining concepts and creating categories. So how do we know when we've found the one that's true? Many philosophers think there are no perfectly right or wrong categories, definitions, or representations in science. Instead of being true or likely, we talk about these being useful, adequate, or fit for purpose. In some models, we might decide the platypus needs their own category. In others, it might be adequate to count them as a reptile, but not as a light smoker. Definitions and categories do reflect facts about the world. So what modeling decisions are directly about what's true or likely? Let's tackle these in two contexts. 1, during model development. 2, when the model is finished. During model development, we often review scientific evidence. For example, we might analyze data on how many Canadians are current or former smokers, and decide the true or likely number is between 40 and 53%. We might assess the link between smoking and a lung disease, and decide it's true or likely that smoking increases the odds of developing the disease. Next, we might input these data to a model capable of making projections, and decide it's true or likely that Canada will have 50 to 100,000 new cases of the lung disease in the next 5 years. To recap, model development involves evaluating evidence and deciding what's true or likely when choosing inputs for the model. When using a finished model, we reason about what's true or likely based on model results. All of this is generally true, but it's also a simplification. Sometimes, model inputs don't have a true or likely value, but rather one that's best for our purpose. And often, model results are a range of scenarios we describe with words like possible. Decisions about what's true or likely pose challenges, and they're subject to error. Most require specialized training and expertise in scientific methods and evidence evaluation. Often, there's uncertainty, and scientists may disagree on what exactly evidence says. Debate and criticism are essential parts of the process. Decisions in modeling can have consequences. Deciding it's true that a drug is safe, or likely we'll have a doctor shortage, affects human health and the economy. Social values play a role in identifying what decisions have serious consequences, what errors are most important to avoid, and how much evidence and agreement we want before we decide. If these decisions can be so serious, who makes them anyway? Watch our next video about social decisions in modeling.